Welcome to the Birthing Center. My name is Jackie Miller. I'm the Administrator for Women and Children's Services here at Catawba Valley Medical Center. First off, let me congratulate you on your pregnancy. Every delivery is unique and special. It is important for you to understand all the options for pain management so that you can make an informed decision along with your healthcare provider before you are here. Many of the techniques may be combined for optimal results, but all may not be appropriate for your individual needs. Please discuss your expectations and your health history with your care team so that we may incorporate these desires into your overall individual plan of care. Your choices for managing labor discomfort include breathing and relaxation techniques, the Care Channel, a relaxation television channel that provides a focal distraction, soaking in a warm tub during labor, walking the halls, having the help of a support person, receiving intravenous pain medication, or receiving an epidural, which will be explained in greater detail later in this video. The Birthing Center also offers nitrous oxide as a pain reliever during labor. Nitrous oxide is a blend of 50% oxygen and 50% nitrous to provide a euphoric effect for the patient. You may want to discuss this option with your provider before your delivery as an alternative to other analgesics or used with other methods of pain management. Regardless of the method you choose, we are committed to providing exceptional health care to every person, every time.
Hello, my name is Paul Packard and I am a Certified Registered Nurse Anesthetist, also known as a CRNA. And I'm the Director of Anesthesia and Peri-Anesthesia Services here at Catawba Valley Medical Center. We utilize a team approach to anesthesia care that involves CRNAs and physician anesthesiologists contracted through Western Piedmont Anesthesia to ensure the safety of both you and your baby. The goal of this video is to enhance your labor and delivery experience, provide detailed information about epidural analgesia, spinal anesthesia, and answer some frequently asked questions. Epidural analgesia is utilized to reduce pain during labor while allowing you to remain fully aware and participate in the delivery of your baby. Medications administered through the epidural work by blocking pain signals that travel along the spinal cord to your brain from the uterus and birth canal. The primary purpose of the epidural is to decrease discomfort and improve your labor experience. The epidural should not be expected to eliminate any and all sensation of labor. In fact, having some sense of contractions or pressure to push facilitates delivery of the baby when the time arrives. If you and your obstetric provider agree that epidural analgesia is appropriate at some point during your labor, the timing of epidural placement is coordinated with you and your care team based on your labor progress, your baby's response to labor, and the amount of pain you may experience. Certain laboratory or diagnostic tests may be required prior to placing your epidural. An intravenous catheter is placed and IV fluid administered prior to the epidural placement to provide an avenue to treat any side effects. You will be asked to complete certain paperwork or consent forms prior to receiving treatment, except in certain emergency situations. The anesthesia provider placing your epidural will first review your health history, medications, allergies, and any laboratory or diagnostic tests that may be required to ensure you are an appropriate candidate for epidural therapy. Some reasons that may prevent you from receiving an epidural or prompt further discussion with your care team are blood clotting problems, allergy to medications used in the epidural, abnormally low platelet count, infection around the site of epidural placement, spinal abnormalities, or inability to follow directions during placement. The anesthesia provider will review significant points of your history with you, perform a focused physical examination, review necessary points of informed consent, and answer any questions prior to proceeding. Complications or side effects experienced with an epidural are rare, but certainly warrant review. A lower blood pressure is a common side effect and readily treated with intravenous fluids or intravenous medications if it becomes too low. Post-dural puncture headache or spinal headache occurs approximately 1 out of every 200 epidurals. The headache results from a small hole in the sac surrounding the spinal cord that allows fluid to leak out. It is typically noticed after the epidural is discontinued and usually resolves on its own. Holding still and maintaining proper position during epidural placement decreases the likelihood of this occurring. There is also a possibility that the epidural does not work as expected, thereby necessitating replacing the epidural through the same procedure as the initial placement. Rare but potential complications are reactions to medication, infection, bleeding, or nerve injury. Most often you will sit on the side of the bed for placement of the epidural. The anesthesia provider will palpate various landmarks of your hips and back to identify the location of the desired epidural catheter placement. It's important for you to remain in proper position throughout the epidural placement to facilitate passage of the epidural needle and catheter into the epidural space. You should look down with your chin, trying to touch your chest, drop your shoulders and slouch or arch your back like a mad cat. Once the desired placement location is identified, your back will be cleansed with a cold antibacterial solution and a sterile drape applied. Local anesthesia, typically lidocaine, is then instilled to blunt the discomfort from inserting the epidural needle. The lidocaine typically burns for a few seconds, and most patients say this is the most painful part of epidural placement. The epidural needle is then placed into the epidural space. It is critical to maintain proper body position and limit movement during this phase of the epidural placement. Failure to maintain position or excessive movements make epidural placement more difficult and increase the likelihood of developing a spinal headache. Once the epidural space is identified, a small plastic catheter is inserted into the epidural space through the needle, and the needle is removed. The catheter is then tested and local anesthetic medication is instilled to facilitate pain relief. A sterile dressing and tape is then applied to secure the epidural catheter. A continuous infusion of medication will be started by the anesthesia provider to manage your labor pain throughout labor. We also supply you with a patient-controlled epidural analgesia button to administer yourself an additional dose of medication if needed. You only need to press the button if you become uncomfortable at some point during your labor. Please notify your nurse if you press the button so they may remain aware of your pain management needs. The epidural typically takes about 10 to 15 minutes to fully work after the first dose of medication is administered. Your legs will become warm, tingly, and heavy. This is all normal as the epidural ascends to decrease your contraction pain. As the baby descends down the birth canal, you may experience pressure in your vaginal area or bottom. Feeling this pressure is beneficial for pushing and delivery of the baby. The epidural does not always help relieve this pressure. Once you deliver your baby, the epidural solution will be discontinued and the catheter removed. Do not try to get out of bed or walk without directions or assistance from nursing staff. Approximately 50% of women may experience a backache after delivery, with or without an epidural. This backache usually resolves on its own. I want to reiterate that the primary purpose of the epidural is to reduce pain, not eliminate all sensation during labor and delivery. Also, if you require a cesarean delivery or a surgical delivery of your baby, a properly functioning epidural may be utilized to provide the anesthesia. A CRNA and a physician anesthesiologist are available 24 hours a day. If you have any questions about your labor epidural or anesthesia, please discuss other pain management options with your obstetric provider, registered nurse, or other members of your care team. Thank you.